Hello, and welcome to another episode of Your Public Health Professional and You, a program of the Maryland Public Health Association. I am your host, Lillian Agbeyegbe, your friendly community health educator. We're having these programs to bring public health close to you, members of the public. We want to introduce you to public health professionals who are working behind the scenes, as it were. Although my guest today works in the community as well, and not just behind the scenes. Today, I'm speaking to Ingrid Lizama, and she's a communications manager at the Latino Health Initiative program of the Department of Health and Human Services. Ingrid, you're welcome to the program.
Thank you so much for the opportunity to be here tonight.
Awesome. We're so excited to talk to you and learn more about your work as a public health practitioner. So you're a communications manager. Two things struck me about your work. One is the Latino Health Initiative, and two is the communications. How important is communications to your work? Before we dive into it, first, let's get to meet Ingrid. Can you tell us a little bit about you? Just introduce yourself and what you do and how you've come to be here today.
Sure thing. Well, hello, everyone. My name is Ingrid Lizama. I am Salvadoran born and raised. I moved to Maryland when I was 10, so I got to grow up in the school system here in my local county, Montgomery County. I started, kind of seeing what path I wanted to take with my higher education. And during a semester in college, I took a women's health class because during that time, my mom had been diagnosed with cancer. And I wanted to learn a little bit more about how I can support her. And I just fell in love with public health. I spoke with my professor at that time, and she said, you can study public health. These are the courses that you would need to take. And they all sounded amazing. I was hooked from the beginning. And a couple of years later, I got my bachelor's with University of Maryland in the School of Public Health.
These are the stories we love to hear. We love to hear how we fall in love with public health straight out of the door. Some people come to us to public health after they've tried some other field, but we like love at first sight, as it were. So your specialization is public health education, and you have had a remarkable career at the Latino Health Initiative. Tell us about the Latino Health Initiative in general, and particularly what you do there.
Sure. So I believe that, fate has us, a purpose. It has a plan for all of us. And before I graduated from my undergrad, I had to take a capstone internship, and I ended up at the Latino Health Initiative. One of the things that attracted me to seek an internship with the Latino Health Initiative was that, one, it was in my local health department, and two, it was targeting Latinos, just like myself and my family. And I was very interested to see and explore the different programs that they had been offering at that time. I was able to get an internship with them, and right away I started working with the Family Reunification program. It's a program that assists children, unaccompanied children that are coming to the county to reunite with their parents after a long period of separation, something that I myself had gone through due to immigration separation from my father. And that not only helped me understand a little bit more about the different types of journeys that sometimes life gives us, but also how I can help others in their own journey as well. There was also an opportunity to work with the Asthma Management Program, something that I didn't know actually existed in my county. I'm also asthmatic, so one of the things that I learned about the program was that even though we have sometimes the resources from our doctors, we don't necessarily know how to use them to our potentials. For example, how to prevent an asthma attack. So it was really cool and interesting working with our local elementary school students and their parents. The program is targeted to Latino parents so that they themselves know how to utilize the medicine, how to create an asthma action plan, and how to prevent asthma attacks. And therefore, the kids have a much healthier lifestyle growing up. And from then on, graduation came and they offered me a position. I was very fortunate to have been selected to keep that position as a health educator, and I have been working there since then. It has been such a wonderful journey, learning different topics, different programs. We have a health promoters program. We have, during COVID-19, a whole entire campaign dedicated to the testing and vaccination, the preventative side, right? During a time of need where our community just needed so much information in general. And that's where the communications piece comes into action, trying to stay in touch with our community in a time where we couldn't be next to each other. Social media started growing. We started utilizing those tools to maintain a communication with them and inform them, educate them, share with them preventative tips so that they didn't get sick, and where to get local resources so that they themselves could access them during the crisis.
Awesome, awesome. You shared so many nuggets there, but I want to zero in on, so this is a Latino Health Initiative. Now, in your own mind, what do you think we would have missed if we didn't have an initiative like this in the community, if we just depended on the general program Department of Health is doing, and then we have a Latino community in our midst? What are the benefits of having a targeted program like this, and what loopholes are we covering with this targeted program?
All right. So with this type of programs, we do focus a lot on culturally competent programs, allowing our community residents to receive the information in plain language, in their own native language as well, something that, even though the department has a lot of resources for it, we are able to tailor it to their common words. For example, here, I'm Salvadorian. I tend to communicate very often with Salvadorian people, and our language, even though it's Spanish, we have some colloquial words, and therefore it's easier to connect with them and assist them in accessing healthcare. It's very important to also try to understand their cultural backgrounds, their morals, their family values, keeping all of that in mind when you're creating a program, but especially when you're also communicating messages tailored and targeting them so that they themselves see the seriousness of preventing diseases or preventing getting sick and accessing healthcare before it's too late.
I love what you said, seriousness of diseases and accessing healthcare before it's too late, because somebody has said this is a little bit more than translating from English to Spanish, right?
Mm-hmm.
Because this is not just, get a Google translator or get somebody to translate. There are nuances of culture, you said, and colloquial words that are particular to communities that we should take into consideration. Is that correct?
Correct. Yes. And during one of the Maryland's Public Health Association conferences that I attended, I really loved what one of the speakers had mentioned when it came to translating documents, is that, they have to be first written in Spanish, so then they could be translated into English, so that way, our targeted population, our targeted community is the first one that we are thinking about, and then we can translate them into English, since it is a language that not so often it's spoken by staff.
Awesome. I remember that meeting where that was said, because, when you write in English and you're translating it into Spanish, you have you're thinking from your own understanding as an English person. Whereas if you start with the Spanish language, you have taken into consideration how that person is going to relate to it, and then they're better able. So that's, and listeners, I hope you're getting that it's really important not just to have the materials be culturally competent, but start from the culture, the language of the culture, and then translate it into English. That way you're not losing things. So, Ingrid, one of the things we like to say is, how do you benefit people who have never met you or who will never meet you? Because we know this program came after COVID, and one of the things that happened during COVID, and you spoke a little bit about that, people are like, who are these public health practitioners? Why are they telling us to social distance? Why are they telling us to wear masks? And people are like, we don't know you, we don't see you. So, but your work is going to benefit members of your community who may never get to see you.
Yeah, and it's very interesting that you put it that way, because my work, although for the very, before COVID with the Latino Health Initiative with LHI, had been to be out in the community, be, one of those grassroots persons talking to the community, allowing them to learn a little bit about what we do, what the department has to offer for them, and how they can continue to take care of themselves and their families. But during COVID, that, that had to be, that had to stop. And even though we were doing, at least I was doing some of the outreach activities with the testing and vaccination, it was different because, we had to wear masks, and we had to tell people, wear your mask, social distance, wash your hands, stay at home if you're sick. And we had to get very crafty and creative with the messaging, especially since, it was coming through a social media source. We learned a lot during that time. A lot of the Latino community was relying on WhatsApp for communicating and sharing information. And we had to also emphasize the importance of not always believing what they read on WhatsApp, because there was also a lot of misinformation on COVID-19 being distributed via that social media platform and many other platforms, right? And we needed to make sure that we were providing accurate information so that people could have access to them, and also take that into account when they were accessing testing or vaccination services. We really wanted to emphasize that people knew that we were credible, that it was coming from a great source from the local health department. And with that same idea, we created a whole entire campaign on for communications. We created a wonderful character named La Abuelina. This was a grandmother, because our community really does look up to the grandmothers for advice, especially when one is sick. And therefore, we created an entire campaign around this character, who was Salvadorian, married to another character named Don Carlos, her husband of Colombian descent. And therefore, we started creating this entire beautiful campaign about getting tested, getting informed, getting the COVID-19 vaccine. And as we got more information, we continued to add more characters. For example, Alex, the grandson of La Abuelina, once we had the vaccines available for the teens. And then we added another character, Valentina, a little girl, as the vaccines were becoming available for the younger kids. It was beautiful because the community received it very well. We were able to continue to disseminate that information via social media, via WhatsApp, via our channels that are mostly watched here in the area by our community, and continue to share information with them about the importance of preventing getting sick from COVID-19 and utilizing the tools that were at hand, like the vaccines, to continue to diminish COVID-19 and having it spread. So, it's one of those things where our work was behind the scenes, behind a screen, but we needed to continue to push that message out to our communities and have them know that we were here providing all those details for them.
Awesome. So, I'm listening to you and I'm grinning from ear to ear because I'm so excited about this campaign, creating the grandmother. And this is what public health does, meets people where they are. Unlike healthcare, medical care that's looking for you to come to where they are, public health meets you where they are. So I don't know how many people will be interested in knowing the role the grandmother plays in the family or the role the grandmother plays in the culture to try and take advantage of that. But public health looks at you, looks at your family and your environment and says, okay, it's the grandmother that people go to for advice and find them very believable. I have received a couple of reminder appointment notices by text, but I've never received any message on WhatsApp. But so you see, but you're looking at it and you say, hey, WhatsApp is a big deal for communicating in this community. So let's not stick to letters. Let's not stick to phone calls. Let's not even stick to text messages, as convenient as text messages are. Let's go the extra route and go into WhatsApp. And it's just so fascinating how you have used that to get into your communities and to benefit community members. Have you seen what's the response to public health in the field? Do you say, I know you talked about your inroad into public health, which was very fascinating. If somebody wants to go into the route of public health, what would be your word of like encouraging them to think that this is something that they can do?
Yeah, one of the things that I often share with others is the impact that you have on community members that you don't even know. I really enjoy going to cafecitos, to coffee meets with parents at the local school systems, and when we get invited to share a little bit about what we do, and we start off with, have you seen La Abuelina, the grandmother? And seeing that they recognized her, that they know that we were out in the field working during COVID-19, and just sharing information with them, and they're able to say, yes, we follow your Facebook page, we follow your Instagram, we've seen that video, we saw it when we were watching our telenovelas, the Spanish soap ops. It's very interesting because it really does teach us that they are paying attention, that they are seeking information, and that one way or another we are impacting their lives. It's very gratifying helping the community members, especially those who are seeking resources. So it's a career that can take many shapes and forms. You can start off as a health educator. There's many people that I know that they're community health workers. They are health promoters out in the field, sharing tips about how to exercise better or how to join a walking group in their neighborhoods. We are very fortunate that the Latino Health Initiative takes into account all those small pieces to continue to bring people together, form community, but at the same time prioritize health, not only for the moms, but also for the little ones. We have several activities where, they can bring their children and create interactive games during our health fair outreach events so that the kids continue to also learn how to eat healthier, how to exercise, the importance of exercising. So we are impacting the community, and it's great to know that we are doing that work. And what better way than connecting with our community members through language, through expressing ourselves, being there and them seeing us in the field.
Awesome. Thank you so much for sharing. Now, you spoke earlier on, you said, at one MDPHA conference where you had this. And so I wanted to talk to this program. It's courtesy of the Maryland Public Health Association. How have you rated the benefit of having a professional body where professionals can go to, So what's your message, for instance, to public health practitioners who are not affiliated with the organization or some professional body?
I think it's great because you get to connect with different people. We were very fortunate to have been nominated for the 2023 Outstanding Public Health Program of La Abuelina campaign. And we were also very honored that we won, that our work was being recognized by the Maryland's Public Health Association. And I really enjoy the speakers and just hearing about all the amazing work that other colleagues are also doing out in the field. field. It definitely doesn't make us feel like we are working on this alone. There's many of us working here in Maryland to continue to push public health and continue to take care of the health of our community residents. I know that, by following you guys on social media, on LinkedIn, on Facebook, on Instagram, you get a lot of updates about what you guys are doing. And at the same time, you get to hear about different other opportunities in which you can, grow as a professional, seek out more information, and just learn a little bit more about what everybody else is doing. One of the things that really caught my attention was the entire effort on climate health, which is something that we as an LHI have been incorporating in the last few years. We have an amazing Charlemos con Zumba program, which is Zumba classes that also allow the participants to learn a little bit more how we can take care of our planet, how climate also impacts our health. So it's very interesting to know that there are so many people out there doing so many different efforts and taking that into account for inspiration. Somehow we can also enhance our programs.
One of the things so wonderful that you shared so much, because one of the things I like about public health is how it adapts to what's coming on. So talking about the environment and public health, I worked on a campaign called Trees for Public Health when I was in New York. And it was looking at asthma really and the atmosphere, and so we went to this campaign to sort of encourage people to plant trees in their house, because the research had shown that with a lot of trees, the atmosphere is healthier because of the biological process of trees. The atmosphere is healthier. So people who live in neighborhoods that have more trees can breathe better. But it turned out that also having trees had other benefits, in the sense that they said neighborhoods that had streets that had trees, people were more likely to drive slower, as opposed to no trees. People think it's a highway and they're speeding. So helping people drive slower was also reducing accidents. It made the atmosphere cool, and so people were more inclined to go for walks, which was now exercising. So it's just this one tree had the benefit of addressing asthma, had the benefit of addressing road accident, had the benefit of addressing obesity, had the benefit of addressing social capital, because people working together will do so much. But there's just so much to do in public health. This is so interesting. I know that we're talking about the Latino Health Initiative, and we're talking about working and tailoring messages. And I really like how you talked about the grandmother and working on these particular programs. Are there some other issues? Are there some areas that you think there's still opportunity for more work to be done? I'm thinking, I don't know if you've done any work in the area of when you go to the supermarket, for instance, and the labels on this. So we have done nutritional labels so that people can know how the calories are. I guess you can read it. But how do we do education around those labels, because they're all written in English?
Yeah, so we are very also lucky to have a healthy eating program here at the LHI, in which we do teach our community participants that participate in this program how to read those labels. And one of the things we have to take into account too is that our community members in the Latino community, they are more often likely are going to be shopping at Latino supermarkets. And those labels are in Spanish, but how do they read them, right? Because most often they're going to be either bilingual, and they might also be in both English and Spanish. So keeping that in mind as well, it's one of those things where we have to get to know our community. Where are they shopping? What are they shopping? Oftentimes one of the things that we learned during the COVID-19 years with some of the food distribution events that were happening in the areas were the need for cultural foods. beans, masa, which is, the flour in which they make tortillas, which is a common staple in the Latino community. We needed to make sure that, those were being distributed to those who needed them at that time. And, we had to continue to push for more education, had to read those labels, had to better pick the seasonal fruits and vegetables available to us so that they incorporate those in their daily eating habits.
Awesome. I like what you said about the food distribution and really being culturally competent, because I know that there's sometimes I go to some places, and I'm originally from Nigeria, and I get some things that, yeah, you can check off the thing that you're giving somebody some food, but does the person eat it? Can they relate to it? Does it mean anything to them? So I'm glad that you were able to inform the programs on sharing appropriate food, not just being able to check the box and say, yes, we give food, but you're giving food that has meaning to the people who are eating the food, as it were. So I know you won a lot of awards and you initiated a lot of programs. There's one particular one that stands out that you'd like to share with us.
Well, yeah, we have been very honored to win several awards for our Abuelina campaign for the Salud y Bienestar program, which is the program that initiated during COVID-19, which translates to our health and well-being. We have won 4 Emmy awards. We have won Muse Awards, Telly Awards. It's been such a wonderful journey working with communications in order to continue to disseminate information to our community. And we have recently also been nominated for an Emmy Award, but not for our COVID-19 efforts, but for our climate and health efforts. We have a wonderful short film available in Spanish from the work that our climate ambassadors have been doing in our community. They explain a little bit about how they remember the climate being when they were children and how it has changed and what we can do to continue to take care of Mother Earth and continue to improve the climate crisis that we're facing, because it does impact our health. And we have that available on our website. I would like to invite everybody who is watching this video to check out our website. You can find us as Latino Health Initiative of Montgomery County, part of the Department of Health and Human Services. We have wonderful information there. We have educational materials in Spanish. We have videos on different topics, whether it's asthma, whether it's the climate health. We have a lot of things on COVID-19 still. And we continue to push more information and awareness on our social media pages. You can find us on both Facebook and Instagram and YouTube. And also we have a TikTok that we utilized during COVID-19, and we need to start utilizing even more because I know that it has so much potential. Our handle is Latino Health Initiative. We continue to push information through those platforms to continue to engage with our community, invite them to our programs. You were talking about the trees and how it links to asthma and so many other topics. We actually started doing recently forest bathing activities with our community members, and it has been it has really gotten the attention of our community members to participate, and they've loved it. So we're very excited that we're doing, a lot of different things, and that in one way or another, we're impacting the health of our community residents, and that we're also getting recognized with all these awards.
Awesome. My guest today is Ingrid, and I'm talking to her because she's working at the Latino Health Initiative. If you're listening to this conversation, then you understand that we can't just say we're doing health work without taking into cognizance the population that we're working with. The Latino Health Initiative has been very intentional about engaging the Latino community, not just translating stuff from English to Spanish, but really understanding the culture, the nuances, the phrases that are familiar, and using concepts like grandmother and grandchild and tailoring messages around that. She has told you you can go on the website, the Latina Health Initiative, and they are on social media. If you are somebody who uses WhatsApp, guess what? They use WhatsApp also. And so you can get their messages through WhatsApp. Want you to follow them on social media, send your questions if you have questions for them, and we heard how Ingrid came to public health straight from high school, from a class that she took. So pay attention. Teachers, invite people to come into your school. You never know who is going to inspire to go on the next step. Ingrid, are there any last words for us as we close? Anything else that you'd like to share about public health, about your work, or about being in Maryland?
Certainly, just continue to seek out information from good sources. Continue to share information via social media, through text messages. Participate of the wonderful workshops that are available in your community, whether it's forest bathing, Zumba, doing activities outdoors, anything that gets you moving is very important. And continue to also learn different topics within public health. I feel that it's always expanding. It's always, filled with so much new information of wonderful programs that are being out in the community that are having such a great impact. And I'm very happy with the career path that I chose. There's never a day in which I wake up and I'm like, I don't want to go to work. It's always such a pleasure because every day brings new challenges and new things that I learn, and it's a way to continue to stay on my toes and share a little piece of what I do with our community, even if it's behind the scenes. Public health is definitely a career that has brought so much joy and great accomplishments to my life. So I'm very grateful, and I'm also thankful for the opportunity to share a little bit of about what I do with you all. And thank you so much for having me.
Thank you. Until I come your way again another time, I am Lillian Agbeyegbe, your friendly community health educator. This is your public health professional and you. Today, you got to meet another public health professional working behind the scenes and in front of the scenes to make sure that you, members of the public, are as healthy as you can be, because we provide you the information based on what the science says, translate it in a language, in a format that you can understand, and make sure that we're supporting you to be the healthiest you can be. Until I come your way another time, thank you for listening. Bye for now.